everyone, and welcome to our Monday Minute. Today I want to share with you some information surrounding the extension of the current federal public health emergency. The public health emergency was set to expire in October of 2021. That has now been extended to the third week of January in 2022. Some very important things to note regarding this extension of the public health emergency primarily include that there is grave concern over activity that is occurring at the state level. The public health emergency waivers that have been put in place specifically on the state level with individual states are beginning to expire without renewal or extension. Even though the public health emergency on a federal basis has been extended and would be applicable on a Medicare federal level as far as waivers, etc. are concerned, there is a question as to how many of them can be expanded and implemented within states where there are specific state public health emergency waivers that have now expired. A perfect example is that in the state of California, one of the public health emergency waivers that was very specific to home health agencies was allowing nurse practitioners, physician assistants, and certified nurse specialists to sign home health orders. That is a federal law that has been passed and implemented from a CMS standpoint. However, it has always carried with it the requirement that it be allowed at the state level. California did allow this in a public health emergency waiver. That expired on September 30th, 2021, has not been extended, and there will have to be legislative action occur before this will again be allowed in the state of California. So this is just one example of state level waivers that have been put in place that we are beginning to see expire without an extension or without being renewed. So you need to be very, very aware that even though the federal public health emergency has been extended, if your state is not allowing some of those specific waivers to be applicable in your state, you will not be able to continue the use of those waivers. So you need to make sure you're clear about that specific element. In addition to that, I want to mention that Phase 4 of the Provider Relief Funds has been open for application. The application process began on 9/29, and it will only go through October 26th at basically midnight. So you need to make sure that if you are applying or want to apply for the Phase 4 funds, that you get that application in by the end of the day on October 26th. Understanding that in the Phase 4 application process, you are likely eligible possibly for some level of funds if you are Medicare certified, Medicaid certified, have billed Medicare and Medicaid, filed federal tax returns, and are currently still providing patient care 2019, 2020, and into 2021. Make sure that you understand it could be a lengthy time before you get a response. They do have to go through the validation process of revalidating your tax identification number, etc. And of course, review your application, make calculations to determine whether or not you will be receiving any funds. We want to thank you all for participating today. We are always thankful that we have healthcare providers on the front lines caring for patients and doing their best to keep us healthy during this public health emergency. Thank you all, and I hope you have a great week.